Today we will discuss another important topic for clinical examination, short stature. Overview: total time allotted for preparation 3 minutes. Try to utilize the whole 3 minutes for reading the scenario and prepare yourself before examination. Examination and discussion time allotted 8 minutes. Warning bell will be given at 6 minutes. Total marks allotted 8. What is the definition of short stature? A height which is 2 or more standard deviation below the mean, which is less than 2 centile for age and gender. What are the most common causes of short stature? You have to think about before you proceed. There are two types, proportionate and disproportionate. Most common, familial short stature, where final height will be short and bone age is synchronized with the chronological age and puberty will be normal. Whereas in constitutional short stature, final height will be normal, bone age will be less than chronological age, like small for gestational age, puberty could be delayed. Nutritional short stature, patient could be short and thin. Endocrine causes, growth hormone deficiency, hypothyroidism, where patient could be short and obese. Think about the syndromes like Turner syndrome, Silver-Russell syndrome, where patient could be short and dysmorphic. Think about the chronic illnesses like cerebral palsy, cystic fibrosis, chronic lung disease, congenital heart disease, hemolytic anemias. Lack of emotions could be a cause of short stature. And think about the disproportionate causes like mucopolysaccharidosis, skeletal dysplasias, achondroplasia, rickets. Introduction: greet before you start, introduce yourself, define your role and responsibility, wash your hand with sanitizer, and take all the COVID precautions. Ask for consent before examination and exposure. Make rapport by asking short question: what is your name? Who is your favorite sports stars? Look for dysmorphism, which could be present in Turner syndrome, Silver-Russell syndrome. Look for any distress, which could be present in chronic illnesses. Any disease stigmata, like cerebral palsy. Measure height, weight, head circumference. Measure BMI. And look at the surroundings. Look for any drugs or device. Now you have to measure length or height, sitting height, upper segment versus lower segment, arm span, mid-parenteral height. Then you have to put in growth chart. And then you have to do some maneuvers. Ask the patient to make a fist. Look for 4th, 5th metacarpal shortening, which could be present in Turner syndrome. You should ask the patient to make a star. Look for any trident hand, which could be present in achondroplasia. Then you ask the patient to stretch hands in front of you. Look for any limb length discrepancy, which could be present in Silver-Russell syndrome. And then check the carrying angle. If it is more than 20 degree, think about Turner syndrome. Then you have to measure whether the patient is having arm shortening, which could be present in rhizomelia. Ask the patient to touch the shoulder with thumb. If arm is smaller than the forearm, think about rhizomelia, which could be present in achondroplasia. Look for short upper limb. Ask the patient to stand straight, and if the hand touches the mid thigh, which is normal, if it is shorter than the length of the mid thigh, then you have to think about achondroplasia. Check spine. Ask the patient to bend forward. If there is any scoliosis, which could be present in Turner syndrome, look for any asymmetry, which could be present in Silver-Russell syndrome, and look for any hyperlordosis, which could be present in achondroplasia. Then you have to do head-to-toe examination, Comment on head. There could be dysmorphism, there could be triangular faces. Check the neck. There could be short neck, any thyroid swelling, or any waving of neck. Comment on chest. There could be barrel chest, there could be shield chest, there could be rudimentary nipple. Comment on abdomen. Abdominal examination may show horseshoe kidney and genitalia for pubertal assessment. Lower limb you should always examine and look for any bowing of leg or any dysmorphism. Important points: always ask for consent before exposure. Try to be methodical. Head to toe examination is the key. Summarize your clinical findings at the end. Common cases given in the examination: Turner syndrome, Russell-Silver syndrome, skeletal dysplasias. Thank you.